Hello and welcome to another edition of Professor Speaks. Today we're going to be talking about getting your prescriptions in the middle of a natural disaster. But before we get into that, I'd like to remind you to hit like, subscribe, and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern, and we are joined here by our esteemed guest and colleague, Dr. Perry Pascal. Thank you for joining us. We wanted to talk about getting prescriptions in the middle of a natural disaster. And so that's why we brought Barry in. He has experience with that. And Dr. Stern, you wanted to share...
Yeah, let me just quickly put this in perspective. Barry is a member of our staff. Before he was a member of our staff, he was an owner of a retail pharmacy. He was involved in a disaster that was a natural disaster prior to California's current wildfires. But we're talking about disasters in general that have to deal with whether they're tornadoes in the southeast of the United States, or whether they have to deal with earthquakes, or whether they have to deal with fires, or whatever. And so we want to take knowledge from things that Barry did. We also want to bring information into what do people do, most especially with regard to preparing for these things, because when you're in the middle of it, you don't have time to prepare anything.
Right, and sadly, they're becoming more and more prevalent as the years go on. We're seeing more natural wildfires, more earthquake-related incidents, and we're seeing more hurricanes and flooding in the southeast. So being prepared is a big part of what states are doing now too, because there's a lot more state mandates to be prepared for what happens and what could occur and the potential problems that can come from that. So, Dr. Stern, you want to take over? How would we prepare? Or actually, no. Before that, we want to talk about Barry's experience. In 1994, there was a huge earthquake. I'm sure all of you are aware, in Northridge, California, and Dr. Barry Pascal owned a retail pharmacy in the middle of Northridge. So, Dr. Pascal, can you go through some of those experiences?
Yes, our drugstore was on the earthquake crack. It went through our drugstore. It was a terrible disaster, as you probably remember or read about. The most important lesson I learned from the earthquake is to be prepared. We weren't prepared. We did not think about being prepared or have a plan for preparation. Neither did the community of Northridge. And therefore, everybody was out of medication when the earthquake occurred. If they weren't out of medication, because of the earthquake, they couldn't find their medication. So we wound up dispensing medication without prescriptions. We were handwriting prescriptions and giving out emergency supplies. Because of our experience, the State Board of Pharmacy in California passed a regulation that in an emergency, pharmacists using their judgment can dispense prescriptions to patients for maintenance drugs and other life-saving drugs. The important thing, I think, for all of us to know is that whether we're a business, whether you're a family, whether you're a person, you need to be prepared, and you need to think about what you're going to do in an emergency. And the best thing you can do is write it down. Write down in a list of what you're going to do in an emergency. For example, if you have a computer, are you going to take your computer? If you're a patient, you're at home, you're a person, you're at home, are you going to take your computer, or are you going to take the backup of the computer? Where is the backup of the computer? Does the computer have a password? Do you have the password so that your wife knows how to download the computer, the backup? Little things like that, thinking in advance. The number one thing I would say that you need to do to think in advance is to be prepared with your medication. The one thing that everybody forgets is medication. We have the forest fires in California. My wife said, what if we get evacuated? How do I take the computers? And what else do I take? I myself, after living through a disaster, listed everything, and I forgot to mention my pills and her pills. And so we now keep our pills in one place, and we have an emergency supply that we keep in an emergency kit by the front door, the exit door. the most important thing I can say, the most important lesson I learned was to be prepared. If you're not prepared, you will wind up making decisions on the spot, and you won't know whether you're correct or not until something happens or that you made a mistake.
All right, let me add a couple of things to it. Last time we talked about having a list of your medications.
Right, and we mentioned that there were apps available. Dr. Stern also mentioned that he likes to write things down. I mean, it's admirable. But there's also other ways to do it. If you don't have your electronics on you, it's always good to keep a list as well. I mean,
so on one level, you need a list of medications. On another level, you need to be able to demonstrate to someone, whether it's a pharmacist or anyone else, that actually I'm approved for these medications and I didn't just make the list up. So, Barry, what can people do to make sure that they have an approved list of medications so that even if they can't get a month's supply or 3 months supply or whatever, then they can go to someone and say, I'm on this medication, I need to have a medication.
Right.
You and I may be able to do with our licenses,
Right.
and people will believe us and they'll give us a couple of tablets. But other people who are not, and they're not licensed, what do they do?
There's many things that you can do. You can make a list yourself on a piece of paper. The easiest thing to do is the next time you're in a doctor's office or call the doctor, ask the nurse to print out your list of medications and have the doctor sign the list. If you have an elderly mother or uncle that you're responsible for, have the physician make out a list of all of the medicines, and you have one, and the facility that your mother or your uncle is in, they should have one also, and have the physician sign it. With electronics today and digital records, it's very easy to print out a list of all your medicine and just have the physician sign it. It's also very good to carry that list with you when you travel. What happens if something happens to your medication and you're in Paris, France, or in London, England? You at least have a list of your medicine that you can show a pharmacist.
And the other piece of this, because Alex likes to bother me about writing things down, is that if your electronics doesn't work, or if you've lost power,
especially in the middle of a natural disaster,
in the middle of a natural disaster,
Exactly.
And you can't charge the phone, or you can't charge your computer, otherwise you have something written down that is totally asynchronous from anything electronic in order to deal with that. The other part of it that we need to address is that there are professionals involved. You're going to go to a pharmacist in order to try and deal with it. There's more going on than just saying to the pharmacist, I need to have my high blood pressure medication. Can you give me some tablets of the high blood pressure medication? They're a professional. They're going to look at it and they can make some decisions to help you as to whether you can skip something or whether if I don't have this, I could give you this and this could work individually, because pharmacists are clinicians. Clearly physicians are clinicians, but we've got a range of clinicians that just need information and they can help make decisions. Did you have any experience with that?
Yes, it's far more difficult today than it was when we had the '94 earthquake, because there are far more generics, and the generic manufacturers change from the time you may get one manufacturer in January of a generic drug and another manufacturer in June, and the pills may look completely different, and it's impossible for a patient nowadays to go in and say, I was taking a little white pill for my blood pressure medicine. Can you give me a supply? That's why you need a record, something printed out. It's just too complicated now to do it orally like we did. The other thing is, another good thing to do is take a copy of your insurance policy, your house insurance policy and your medical insurance policy, run the front page that has the information of who the broker is or the agent or the phone number, and put it with that medicine list, in your emergency kit. Because in an emergency, you may know you have State Farm insurance, but it may take you a little while to get to State Farm, where it may be easier if you have the policy number you have the
Right.
agent number, you have the coverage number, and you just need the front page.
Right.
And the other thing to say here, which I think is also important, is you have a medication, you take it every month, so you're expecting to get, under typical times, to get a 30-day supply, or perhaps you get 60 or 90-day supply, or you get it from mail, etc. Well, all of those systems may not work in the middle of a disaster. State laws, it certainly is true in California, it's true in many other states, where they have identified the fact that pharmacists have the right and the responsibility to supply medications to you, even if you don't have a prescription with you. So having said that, you have the opportunity to get medicines. You may not get 30 tablets. Maybe the pharmacy has been harmed by the disaster as well and doesn't have it. They may be able to give you a few days, and certainly California state law and so do other laws allow that with regard to their boards of pharmacy. But understand that you need as much as you need in order to get through the disaster. You may have to come back. You may get a few days, you may have to come back again to deal with it. But once again, you need to rely on the expertise of the pharmacist. This is not just, here's what I need, give me 3 tablets. It's, here's what I need, what are my options if there are no other options?
Yeah.
And that's where you need to address it.
To add to that, during the '94 earthquake, when we were dispensing a 7-day supply, the reason we were giving a 7-day supply is because we weren't sure that the wholesaler was going to replenish or be able to get to us to replenish our medication. So we didn't anticipate we were going to get deliveries for 3 weeks, 2 weeks, whatever. So we had to parse out to the community a supply so that more people could get medication.
And I think a big takeaway here is develop that communication or a relationship with your local pharmacist that maybe will make these times of extreme pressure, especially for the pharmacist, but make these times a little easier to go through. So you can go to your local pharmacist, you can say, I was here 30 days ago, a week ago, a month ago, or 2 months ago, and my pills are back at the house. I don't know where they are. I can't find them. My house burned down, like with wildfires that are going through right now. It's good to develop that communication with your pharmacist and your doctor. We talk about it nonstop here on Professor Speaks, that you need to talk to your doctor, ask questions, talk to your pharmacist, ask questions. You have that relationship already built in that'll make these run a lot smoother.
And also the pharmacy can print out a list of all of your medication.
Yes.
If you go to one pharmacy, they can print out a list of everything. You have the pharmacist sign it, and then next time you go see the doctor, take it in with you and have the doctor sign it. And theoretically, that's as good as a prescription.
Yes.
So the important thing, and let me just summarize it, is have a list of your medications, both in writing and electronic if you wish. Make sure that you have it signed or in some way that it's clear that you're taking those medicines. Make sure you keep it with you. And at the end of the day, be prepared. Think about on a regular basis, what do I need? What am I going to do? What am I going to take with me so that I'm prepared? Because this is catastrophic. People have lost their homes. They've lost their livelihoods. In effect, they've lost a whole portion of their lives. And while you do that, you don't want to lose your life because you don't have the medicines that you need.
Exactly. So, one last thing. Anything you guys want to add?
No, I think we
I think we pretty much covered everything. Of course, if you have questions or comments yourself, please leave them below. We'll have producer M. She'll put up links. We have several documents that Dr. Stern provided that'll help better understand the situation and in more detail. Once again, we would like you to go to ProPharmaConsultants.com. I'd like to thank Dr. Barry Pascal, Dr. Craig Stern, and visit ProPharmaConsultants.com. Remember to hit like, subscribe, and hit the little bell for notifications.